I'm Dr. Tom Etter, and this video is about the common types of conditions of the shoulder and chiropractic treatments of those conditions. The most common tendinitis of the shoulder is tendinitis of the rotator cuff, specifically the supraspinatus tendon. The supraspinatus tendon runs from back of the shoulder here into the front of the shoulder. It's also known as what's called impingement syndrome or rotator cuff tendinitis, or sometimes bursitis. This condition is often caused by people who work overhead or such activities as swimming, where there's a lot of raising of the arm over the head, and that causes what's called impingement syndrome of the shoulder. Treatment of the rotator cuff in this fashion here is oftentimes successfully done by myofascial release treatments, in which the shoulder is positioned in this fashion here, and then reaching behind the shoulder here, and this is a technique known as myofascial release treatment. Generally, this treatment is done for about 5 to 10 minutes and repeated several times a week until the condition subsides. And that's what's called myofascial release treatment. The second most common tendinitis of the shoulder is what's called biceps tendinitis. Biceps tendinitis often results in younger people from throwing motions and in older people in pushing or office type work. The biceps tendon is in this area right here and oftentimes produces pain at the front of the shoulder. These tendons can also be injured what's called the transverse ligament of the biceps, and if there's a snapping at the shoulder, that can oftentimes indicate that the transverse ligament has been ruptured. And the biceps tendon is treated in this fashion here, and then by drawing the arm back here. And that's also repeated several times per treatment. And those are two of the most common types of biceps or tendinitis of the shoulder and chiropractic treatments. Thank you for watching the video, and if you have any questions, feel free to contact me and I'll answer them the best I can.